So we have two experts with us today to discuss uterine fibroids, Dr. Gustavo Elias and Dr. Samer Hijaz. According to the NIH, 80% of African American women and 70% of Caucasian women will develop fibroids by the age of 50. Dr. Elias, can you tell us what uterine fibroids are?
Well, uterine fibroids are benign tumors that grow in the fibroid in the uterus itself, and they can cause a lot of different symptoms in women. The big ones being abnormal bleeding, menstrual bleeding, pain during their cycles, and it can even cause pain with their back if they're pressing up against the back, or they can cause urinary or bladder issues if they're pressing up against the bladder.
Okay, so these aren't normal symptoms by any means, so they could disrupt daily living for women. Dr. Hijaz, what are some of the treatment options?
Treatments would be medical treatment to try to actually control the symptoms. There's a surgical treatment where a GYN doctor would go in and actually remove the fibroid or remove the whole uterus. And there's also the non-surgical, minimally invasive treatment that has become more popular over the last 20 plus years, where we go in as interventional radiologists and actually treat the fibroids without the need for a major surgery with a major recovery.
Okay, great. So that treatment that you were talking about, I believe, is referred to as uterine fibroid embolization. Dr. Elias, how does that work and how is it different from other treatments?
The way this works is that other treatment options, like Dr. Hijaz was mentioning, involve some kind of surgery where you're actually physically cutting out or removing either the fibroid tissue or even the whole uterus. This technique doesn't do any of that. It's done through a very small hole in the artery. What we do is we take a small catheter inside the artery, and then we, under x-ray guidance, cut off the blood supply of the fibroids. Typically your uterus has one artery for the right, one for the left side, and then we locate the arteries to those fibroids, and then we inject very tiny microscopic beads to plug up the blood flow to the fibroids, and then over the course of several weeks to months, those fibroids will shrink, and then hopefully the symptoms will improve.
Fantastic. Dr. Elias, Dr. Hijaz, thank you very much for your time today. We appreciate it. Viva has two locations in Central Virginia, Fredericksburg and Richmond. Please call the number that you see on the screen to schedule a consultation if you'd like to learn more about uterine fibroid embolization.